My name is Cara Permenter, and I am a family medicine physician at Christus Physicians Group. I grew up actually close to here, about 2 hours south of here, small town. Graduated in a small high school, very small community, and I wanted to go somewhere bigger for college and medical school. So I migrated north to Shreveport, and I've been here for the last 10 years or so. It would be a gentleman by the name of Jim Gregory. He was an uncle of mine. I met him shortly before I married my husband, and I attribute the reason I've made it as far as I have to him and his dedication to my professional development. And sadly, he passed away in 2014, so he hasn't seen me finish it, but I still remain close with his wife. A lot of my family has been in and out of hospitals, not, typical Southern family, didn't eat the best and take the best care of themselves. And so in and out of the hospitals, and I'm just watching the interaction with the medical teams, with my family, the complaints that my family had about the way things were done and just the treatment of patients. I wanted to make a difference. I wanted to make a change in medicine, and I felt like the best way to do that was to get involved and treat patients differently than we'd experienced in the past. The broad spectrum. I love that anything that walks in my door, I should be able to at least get them started on where they need to go. Our healthcare system is very complex. It's very difficult to navigate, especially for patients that are not at all familiar with what's going on. And I like to be that person for them. And I feel like primary care is where that's at. Coordinating care and kind of, in terms of being the wheel, you're kind of the center of the wheel and you kind of coordinate everything off of that, and I kind of like being in that central role for a patient. Philosophy on patient care includes, a compassionate, patient-centered approach to medicine. I want the patients to be actively involved in their care, making goals for themselves, and me just kind of being their cheerleader in the background. I think that's a big part of it, motivating them to take care of themselves. Quality of life is a big thing as well, and maintaining as much quality of life as I can for patients and teaching them how to do that for themselves as well.